Homelessness is a complex issue, but homelessness is a fixable problem. The simple solution is just putting someone in a home.
Housing first just means the person with the highest acuity gets the next available housing.
So in the past, people would have to get sober or take their medication. Now in Columbia and Boone County, we're shifting our focus to a housing first model, which says that we simply put people in housing first, and then we focus on other issues that they have. The City of Columbia has tended to be kind of the unofficial lead on the issue of homelessness, but certainly we're only able to address it through partners like the VA Hospital, the Housing Authority, other entities like the county and the United Way helped us organize a homelessness summit.
Have you had a close friend or a family member experience homelessness?
One of our goals at the summit was to pull in national thought leaders so that we could kind of relay to the community what's going on at the national level. One of those persons is actually an international thought leader on homelessness, and that's Linda Kaufman with Community Solutions, and she's one of the early pioneers of Housing First.
I'm asking that you change your homeless system from working like a McDonald's to working like an emergency room.
The funny thing is that there are no predictors of who's going to make it in housing. I can't look at you and say, oh, if she has substance use and mental health and, and heart problems, she won't make it, so we won't even bother. We don't know. So if we can't predict who's going to succeed in housing, then I say whoever has the highest acuity in the community gets the next available housing. And then you just work really hard to keep that person in housing.
A key component of the Housing First model is what's called a by name list, and that is this idea that you know who your chronically homeless population is. And then another part of Housing First in the by name list is to prioritize folks based on risk. And to do that, we use a nationally normed instrument called the VI SPDAT. And what that does is allows us to get a score of risk.
For years, we looked at building affordable housing and not thinking through the process holistically. Do we have the necessary services in order for them to be successful? Are the resources there? Think about the educational system where we're placing, affordable housing, where we're placing people, and especially people with families.
So when we think about homelessness, the first thing that comes in most people's minds is a rough-looking guy on the street. But the reality is that the vast majority of homeless persons in our country and in our community are actually women and children, families. And they aren't homeless in the traditional sense necessarily they're on the streets, but they're often living in circumstances that we call doubled up or couch surfing. So mainly that means people living in places that are not their own.
Some of the, misconceptions we have about homelessness is really something that needs to be brought to everyone's attention in a community. And I really love that today when they said, as soon as you put someone in a home, they're not homeless anymore.
What we're doing is simply trying to use what's worked in other communities, what's been proven to work, and try to replicate that here. And really, in the end, just do the best we can.